Eat garlic. Avoid these 6 dangerous mistakes seniors must know. Have you ever added garlic to your food, thinking you were protecting your heart, lowering your blood pressure, and strengthening your immunity, only to feel discomfort later and wonder what went wrong? After 50, the body changes. What once helped can sometimes harm if used the wrong way. Garlic is powerful, yes, but power without knowledge can quietly create problems. Many seniors make simple garlic mistakes every day without realizing the hidden risks. And those small habits can affect digestion, blood pressure, medications, and even surgery recovery. Today, these 6 garlic mistakes will be uncovered before they affect long-term health. Before getting into these important mistakes, take a moment to support your health journey. Subscribe to the channel, like this video, and share it with someone over 50 who uses garlic daily. Small knowledge today can prevent big health problems tomorrow. Your health truly matters here. Using too much raw garlic daily can irritate the digestive system, especially after the age of 50. Garlic is natural and widely respected for its heart-supporting and immune-boosting properties. But natural does not always mean harmless in large amounts. Many older adults believe that if 1 clove is good, several cloves must be even better. However, research shows that raw garlic contains potent sulfur compounds, including allicin, that can be very strong on the stomach lining. As the body ages, the protective lining of the stomach becomes more delicate, and digestive enzymes do not work as efficiently as they once did. This makes seniors more vulnerable to irritation and discomfort. Some doctors warn that consuming large quantities of raw garlic every day can trigger acid reflux symptoms. Heartburn, chest burning, and a sour taste in the mouth may become more frequent when the lower esophageal sphincter relaxes in response to strong foods. Raw garlic is highly concentrated, and in sensitive individuals, it can relax this muscle and allow stomach acid to move upward. For someone over 50 who may already struggle with mild reflux, this daily irritation can slowly worsen symptoms and disturb sleep. Excessive raw garlic can also aggravate gastritis. Gastritis, which is inflammation of the stomach lining, becomes more common with age due to medications, stress, and natural thinning of protective tissues. Studies have noted that spicy and pungent foods can intensify this inflammation. Raw garlic, when eaten in large amounts, acts as a chemical irritant. Instead of soothing the digestive tract, it may cause burning pain, nausea, or a heavy bloated feeling that lingers for hours. Seniors sometimes mistake this discomfort for normal aging, not realizing that the quantity of raw garlic may be contributing to the problem. Bloating and gas are also common complaints. Garlic contains fructans, a type of carbohydrate that can ferment in the gut. As digestion slows with age, these compounds may not break down as smoothly. This fermentation process can create excess gas, abdominal pressure, and cramping. Gastroenterologists often advise patients with sensitive digestion or irritable bowel tendencies to monitor their intake of high-fructan foods, especially in raw form. Cooking garlic can reduce some of this intensity, but eating it raw and in large amounts keeps these compounds fully active. Another concern involves the cumulative effect of daily overconsumption. A small amount occasionally may not cause harm, but taking several raw cloves every single day can create ongoing irritation. The digestive system does not always recover quickly at this stage of life. Repeated exposure to strong compounds may weaken comfort over time, leading to chronic symptoms rather than temporary ones. What begins as a health habit can quietly turn into a source of inflammation. Moderation protects the stomach, while still allowing garlic to support health. Many nutrition experts suggest that 1 small clove per day, especially when combined with food, is generally well tolerated by most healthy adults. The body responds best to steady, reasonable amounts rather than extremes. After 50, gentleness matters more than intensity. Garlic remains a valuable food, but respect for its strength is essential. The goal is not to eliminate it, but to use it wisely. Listening to digestive signals, avoiding excessive quantities, and understanding that more is not always better can prevent unnecessary discomfort. A balanced approach allows garlic to remain a helpful ally, rather than becoming an avoidable source of irritation. Taking garlic supplements without doctor approval can create serious health risks for adults over 50. Garlic capsules, aged garlic extract, and concentrated tablets are often marketed as natural solutions for heart health, cholesterol, and immunity. Because they are sold without a prescription, many people assume they are automatically safe. However, concentrated garlic does not act like a simple food. It behaves more like a mild medication inside the body, especially when taken daily in capsule form. Garlic supplements can interact with blood pressure medications. Some doctors warn that garlic has natural blood pressure lowering properties. When combined with prescribed antihypertensive drugs, the combined effect may cause blood pressure to drop too low. This can lead to dizziness, lightheadedness, blurred vision, or even fainting. For older adults, a sudden drop in blood pressure increases the risk of falls, which can result in fractures or hospitalizations. What seems like an effort to protect the heart may unintentionally create new dangers. Blood thinners are another major concern. Garlic has natural antiplatelet effects, meaning it can reduce the blood's ability to clot. Research has shown that garlic supplements may increase bleeding time. For seniors taking medications such as warfarin, aspirin, or newer anticoagulants, adding garlic capsules without medical supervision can amplify this effect. Some doctors report cases where patients experienced easy bruising, nosebleeds, or prolonged bleeding from small cuts after combining supplements with prescribed blood thinners. In more serious situations, internal bleeding risks may rise. Diabetes medications can also be affected. Garlic has been studied for its potential to lower blood sugar levels. While this may sound beneficial, combining garlic supplements with insulin or oral diabetes drugs may cause blood sugar to drop too far. Hypoglycemia can bring shaking, confusion, sweating, weakness, and in severe cases, loss of consciousness. Older adults may not always recognize early warning signs quickly. Careful monitoring is essential when any supplement has blood sugar lowering potential. Another important issue is dosage strength. Fresh garlic used in cooking contains beneficial compounds, but the amounts are typically moderate and spread throughout meals. Supplements, on the other hand, deliver concentrated doses that may equal several cloves in a single capsule. These higher doses can place extra strain on the digestive system and circulatory system. Clinical studies that evaluate garlic's benefits use controlled and standardized amounts under supervision. Self-prescribing similar doses without guidance removes that safety oversight. Seniors often manage multiple prescriptions at once. This is known as polypharmacy, and it increases the likelihood of drug interactions. Pharmacists frequently advise older adults to review all supplements with a healthcare provider, because even natural products can alter how medications are absorbed, metabolized, or eliminated. Garlic may affect liver enzymes that process certain drugs, potentially changing their effectiveness. A medication meant to stabilize health could become either too strong or too weak when combined with unmonitored supplements. There is also the misconception that if a supplement is sold in health stores, it has been thoroughly tested for safety in every population. Dietary supplements are not regulated as strictly as prescription medications. The exact concentration of active compounds can vary between brands. This makes it difficult to predict how the body will respond, especially in individuals with heart conditions, kidney concerns, or fragile blood vessels. After the age of 50, the body processes substances differently. Kidney function, liver metabolism, and circulation patterns gradually change. What was tolerated at 35 may not be tolerated at 65. For this reason, many healthcare professionals emphasize that every supplement should be discussed openly with a doctor or pharmacist. Garlic is powerful and can be beneficial, but it must be respected for its biological activity. Avoiding garlic supplements without medical guidance does not mean avoiding garlic entirely. It means recognizing that concentrated forms require supervision. A simple conversation with a healthcare provider can prevent complications and ensure that any supplement supports existing treatment rather than interfering with it. Careful coordination protects both safety and long-term health. Eating garlic before surgery or dental procedures can increase the risk of excessive bleeding and delayed healing. Garlic naturally has antiplatelet properties, meaning it reduces the ability of blood platelets to clump together and form clots. While this effect may support heart health under normal circumstances, it becomes a concern when the body needs to control bleeding during or after a medical procedure. Surgeons and dentists rely on normal clotting to prevent complications, and anything that interferes with this process can raise risk. Research has shown that garlic, especially in supplement or concentrated form, can prolong bleeding time. Some doctors advise patients to stop taking garlic supplements at least 1 to 2 weeks before scheduled surgery. This precaution is similar to the guidance given for certain medications and herbal products known to affect clotting. Even though garlic is a common kitchen ingredient, its biological activity is strong enough to influence how blood behaves under stress. For adults over 50, the concern is greater. Healing tends to slow with age due to changes in circulation, immune response, and tissue repair. When bleeding continues longer than expected, recovery can become more complicated. Prolonged bleeding during surgery may require additional medical intervention. After dental extractions, it may lead to persistent oozing, swelling, or delayed clot formation. These complications can increase discomfort and lengthen recovery time. Garlic supplements present an even higher concern because they deliver concentrated doses. A single capsule may contain the equivalent of multiple cloves. Studies examining garlic's cardiovascular benefits often use standardized extracts that significantly affect platelet activity. When such doses are taken daily leading up to surgery, the blood's clotting ability may already be reduced before the first incision is made. This effect may not be obvious until a procedure is underway. Another important issue is communication. Many patients do not consider garlic a substance worth mentioning during preoperative evaluations. Because it is a food, it often feels harmless. However, anesthesiologists and surgeons frequently ask about herbs and supplements, precisely because of their impact on bleeding and anesthesia. Failing to report garlic intake can leave the medical team unaware of a preventable risk factor. Transparency allows healthcare providers to plan safely. There have been documented cases where patients experienced unexpected bleeding linked to herbal supplements with antiplatelet effects, including garlic. For this reason, professional medical organizations often recommend discontinuing certain supplements before surgery. The goal is not to discourage garlic use entirely, but to recognize that the body needs normal clotting during invasive procedures. Dental procedures may seem minor compared to major surgery, yet bleeding control remains essential. Tooth extractions and gum surgeries depend on stable clot formation to protect the underlying bone and tissue. If clotting is impaired, it may increase the risk of complications such as dry socket or prolonged discomfort. Dentists commonly advise patients to inform them about all supplements for this reason. The timing of discontinuation matters. Some doctors suggest stopping garlic supplements at least 7 to 14 days before surgery, depending on the type of procedure and individual health conditions. This allows platelet function to gradually return to normal. The exact recommendation should always come from a healthcare professional familiar with the patient's medical history. Garlic remains beneficial in many everyday situations, but it must be handled carefully before medical or dental interventions. Temporarily stopping garlic, particularly in supplement or high-dose form, is a simple precaution that can reduce preventable complications. Respecting its blood-thinning properties ensures that surgical teams can work with predictable clotting, protecting safety and supporting smoother recovery for older adults. Eating garlic on an empty stomach with a sensitive gut can lead to irritation, burning, and digestive distress, especially after the age of 50. Raw garlic is highly concentrated in sulfur-containing compounds such as allicin, which give it powerful health properties but also make it strong on delicate tissues. When consumed first thing in the morning without any food to buffer it, garlic comes into direct contact with the stomach lining. For some seniors, this direct exposure can feel sharp and uncomfortable within minutes. As the body ages, the protective mucus layer of the stomach gradually becomes thinner. Digestive processes also slow down, and the stomach may produce acid differently than it did in younger years. Gastroenterologists explain that this increased sensitivity makes older adults more vulnerable to irritation from pungent foods. While a younger digestive system might tolerate raw garlic on an empty stomach, a sensitive gut over 50 may react with pain, cramping, or a burning sensation that lingers. Acid reflux is a common condition in this age group. Studies show that the lower esophageal sphincter, the muscle that keeps stomach acid from rising into the throat, can weaken over time. Certain strong foods, including raw garlic, may relax this muscle further. When garlic is eaten alone without food, stomach acid may be stimulated more intensely. This combination can trigger heartburn, chest discomfort, and a sour taste in the mouth. Some doctors advise patients with reflux to be cautious with raw garlic, particularly in the morning before any protective meal. For those with a history of ulcers or gastritis, the risk may be even greater. Ulcers involve open sores in the stomach lining, and gastritis involves inflammation of that lining. Both conditions require gentle care. Research indicates that highly pungent foods can aggravate existing inflammation. Eating raw garlic without food may intensify symptoms such as nausea, upper abdominal pain, or a feeling of heaviness. Instead of supporting health, the habit may worsen discomfort and delay healing. Irritable bowel symptoms can also be triggered. Garlic contains fermentable carbohydrates, known as in individuals with sensitive digestion, these compounds may ferment quickly in the gut, producing gas and bloating. On an empty stomach, the effect may feel stronger because there is no other food to slow digestion or dilute the compounds. Gastroenterology experts often recommend that people with irritable bowel tendencies monitor their response to high-fructan foods and adjust accordingly. Pairing garlic with food can significantly reduce irritation. When garlic is mixed into a meal, other ingredients help dilute its intensity and slow its absorption. The presence of proteins, healthy fats, and complex carbohydrates can create a buffering effect that protects the stomach lining. Many nutrition specialists suggest that consuming garlic as part of a balanced meal is gentler on the digestive tract than swallowing raw cloves alone. Trends on social media sometimes promote eating raw garlic first thing in the morning as a quick health boost. However, doctors frequently remind patients that what works for one person may not work for another. After 50, listening to the body's signals becomes essential. Persistent burning, nausea, or abdominal discomfort are not signs of the body adjusting. They may be warnings that the digestive system is under stress. Using caution with garlic on an empty stomach does not mean avoiding it completely. It means recognizing personal tolerance and prioritizing digestive comfort. A sensitive gut deserves protection, especially in later years when recovery from irritation may take longer. Respecting how the stomach responds and choosing a gentler approach can allow garlic to remain part of the diet without causing unnecessary pain. Assuming garlic replaces prescribed medication can put serious health at risk after the age of 50. Garlic does have scientifically studied benefits for heart health, circulation, and immune support. Some research suggests it may help modestly reduce blood pressure and improve cholesterol levels. However, these effects are generally mild compared to the strength and precision of prescribed medications. Doctors emphasize that natural support does not equal medical replacement. Blood pressure medication is carefully prescribed based on individual readings, risk factors, and overall cardiovascular health. When someone reduces or stops these medications without supervision, blood pressure can quietly rise again. High blood pressure often has no clear symptoms, which is why it is known as a silent condition. Uncontrolled hypertension increases the risk of stroke, heart attack, kidney damage, and vision problems. While garlic may offer supportive benefits, studies show that its effect is not strong enough to replace antihypertensive drugs in people who need them. Cholesterol management is another area of concern. Garlic has been studied for its potential to slightly lower total cholesterol and LDL levels. However, cardiologists explain that prescription statins and other cholesterol-lowering medications work in a much more targeted and measurable way. They reduce plaque buildup inside arteries and significantly lower the risk of major cardiac events. Stopping these medications based on the belief that garlic alone is sufficient can allow cholesterol levels to climb again, increasing long-term cardiovascular danger. Some seniors also manage diabetes alongside heart conditions. Although garlic may have a modest influence on blood sugar, it does not replace insulin or oral diabetes medications. Endocrinologists caution that blood sugar control requires consistent monitoring and properly dosed treatment. Relying solely on garlic can lead to unstable glucose levels, which may damage nerves, kidneys, and blood vessels over time. Even small elevations sustained over months can create complications. Another issue is the misunderstanding of research headlines. When studies mention that garlic supports heart health, they are often referring to modest improvements under controlled conditions. These findings do not suggest stopping medical therapy. In clinical trials, participants usually continue their prescribed medications while adding garlic as a complementary approach. The benefit comes from combination and balance, not substitution. Healthcare professionals frequently remind patients that medications are prescribed because the risks of untreated disease outweigh the potential side effects. Decisions are based on years of research and individualized assessment. Abruptly discontinuing medication without consulting a physician can cause rebound effects. Blood pressure may spike suddenly, or cholesterol levels may worsen before symptoms appear. This creates preventable danger. Garlic can still play a positive role in a heart-conscious lifestyle. When used as part of meals in reasonable amounts, it may support circulation and provide antioxidant benefits. Many doctors are open to patients including garlic in their diet while continuing prescribed treatment. The key is communication. Informing healthcare providers about dietary changes ensures that all parts of a health plan work together safely. Believing that a natural food can fully replace medication may feel empowering, but it can also create hidden risks. Long-term well-being depends on stability and careful management of chronic conditions. Garlic works best as a partner to professional care, not a substitute for it. Trusting medical guidance continuing prescribed therapy, and using garlic responsibly offers protection that supports both safety and strength in later years. Storing and preparing garlic incorrectly can create serious health risks, especially for adults over 50. Garlic is generally safe when handled properly, but certain storage methods can encourage harmful bacterial growth. One of the most concerning situations occurs when fresh garlic is stored in oil at room temperature. Food safety experts warn that this environment can allow the growth of Clostridium botulinum, the bacteria responsible for botulism. This organism thrives in oxygen conditions, such as oil-covered garlic kept unrefrigerated, because botulism toxins are invisible and odorless. Contamination may not be obvious before consumption. Botulism is rare but extremely serious. It affects the nervous system and can lead to muscle weakness, difficulty swallowing, blurred vision, and in severe cases, breathing problems. Older adults may be more vulnerable to complications because immune response naturally weakens with age. Recovery from foodborne illness can also take longer after 50. And dehydration from vomiting or diarrhea may become more dangerous. For this reason, public health agencies strongly advise refrigerating garlic stored in oil and using it within a short time frame, or purchasing commercially prepared products that contain approved preservatives. Whole garlic bulbs should be kept in a cool, dry, and well-ventilated place. Excess moisture encourages mold growth, and storing garlic in sealed plastic bags or damp areas can trap humidity, creating conditions for decay. Moldy garlic should never be trimmed and used. It should be discarded entirely. Food safety specialists emphasize that visible spoilage indicates deeper contamination that may not be safe to salvage. Preparation methods also matter. Overcooking garlic at very high temperatures can destroy many of its beneficial compounds. Allicin, one of garlic's most studied active components, forms when garlic is chopped or crushed. However, prolonged exposure to intense heat can reduce its potency. Some research suggests that allowing chopped garlic to sit for several minutes before cooking may help preserve certain beneficial properties. Extremely high heat, especially frying until dark brown or burnt, not only reduces benefits, but can also create bitter compounds that irritate the digestive in older adults. Proper storage and careful preparation protect both safety and nutritional value. Keeping garlic dry and cool, refrigerating garlic in oil, avoiding prolonged room temperature exposure, and cooking it gently all help preserve its benefits. Respecting these simple precautions ensures that garlic remains a supportive addition to meals rather than a hidden source of risk. Thank you for spending these few minutes here. Growing older does not mean giving up strength or comfort. With the right foods and small daily choices, the body can continue to support you well. This channel is here to share simple, research-based guidance that helps people over 50 stay steady, active, and confident. Take care of yourself, listen to your body, and join us again for the next video.